So again, my name is Nikki. I'm the Director of Training and Get Outdoors PA with PRPS. Thank you for joining our roundtable today on community centers. We're excited to have you all. I do want to mention really briefly that many of you have probably seen the reopening guidelines that were distributed by PRPS over the last couple of days. I know there's been a lot of feedback on social media as we've received a lot of questions via email. I just want to put this little disclaimer out there that those are not strict rules and regulations. Those are interpretations of PRPS of state and federal regulations. So they are more of our recommendations or our viewpoints of what those regulations are and mean as far as the phasing for reopening of park and recreation facilities and operations. So they are not something that you have to strictly adhere to. They are ever changing as new guidance comes out. For example, we're waiting for the CDC guidelines on summer camp to be available, and as such will be updated on that chart. So any questions, you can feel free to email us at PRPS. We are doing the best we can to provide guidance, but of course, we are trying to fill in blanks that have not been provided. For example, by the state, they have not actually acknowledged summer camp. They've acknowledged childcare, but when it comes to summer camp, we're doing the best we can to kind of clarify any issues. So again, if there's questions, please feel free to email us and we'll try to help you out the best we can. But to start off, this is the Community Center Roundtable, and I know last time we had some really great discussion. And one of the first things I wanted to ask is, I know most people are still in the red. We have a handful of counties that are in the yellow. How many of you, or can any of you speak to, if you're in the yellow or the red, how are you amping up to start opening your center when you're available? And just a reminder, unmute yourself if you want to speak or use the chat box.
Hi, my name is Darlene. I'm from North Fayette Township. We go into the yellow this Friday, May 15th. To be honest with you, there's not much talk about what we need to do about ramping up because we're waiting for the CDC guidelines. We're just in a holding pattern. I know probably the first thing we're actually going to open for is going to be the election on June 2nd. They actually moved the whole entire township into our building. So that should be interesting.
Thank you. Tyler from Upper St. Clair said they're on hold until they get further guidance about the green phase. And Lower Paxton, the Friendship Center, they are still in the red. Anyone else?
Lauren Arizari, Conshohocken Borough. We're still in the red. Our plan is to open up June 8th. And then we will only be open for summer camp, though.
Great.
Yeah, I'm here. Hi, I'm Cheryl from Phoenixville Borough. We're in Chester County. We are also in the red. Actually, our building is being used by Public Works right now. They're trying to spread out the Public Works employees so that they are not on the same location. So we still don't have access for quite a few more weeks. We are also a polling place. And even though we're on lockdown till June 4th, they will open the building for elections on June 2nd. So that's the first that the building will be open to the public in months. So that's what we're looking at right now.
Okay. Anyone else? We do have a couple of responses in the chat box. Chris from Middle Smithfield Township in Monroe County, they are in the red until at least June 8th, so they do not have current plans to reopen until late summer. Upper Marion Township, also still in the red. They're waiting guidance on the green phase. Lower Makefield Township, Bucks County, still in the red, will not open for any type of programming until the green phase. When you reopen, whether you're waiting till the green phase, do you think you'll open full hours again? Or will you have limited hours? Will you do staggered hours, especially for those who are opening maybe a little sooner? And with that, will staffing be an issue, do you think?
I think we plan to open for limited programs, depending upon what the program is. And we probably won't do rentals or bring our seniors. Our seniors are in there about 70% of the time back until we're phased out.
Okay.
Hi, this is Gwen Ann with Upper Marion. We're juggling a lot of different recommendations, and one of them is that we would open our center as a membership-based or pass holder-based center, so that we would open specifically for them in the beginning with staggered arrival times. You would kind of say when you want to arrive, you'd have a specific amount of time. We'd open, let's say at 8 a.m., a couple of shortened hours. 8 a.m., give people a 45-minute workout, socially distancing our cardio equipment, moving some of it to different locations, and then everybody out, let's say at 9, and do a deep clean or a, fairly deep clean, let the next group in at 9:30 and kind of work in that area. Really depends on what our capacity limits are, how we can, what's suggested in that way. Certainly, I don't see any group games. I don't see any of our basketball courts being able to be used for that. But a family who has a membership could come in, and a family on a hoop, so to speak. Those kinds of things is what we are currently throwing about. But of course, until we get further guidance, we are kind of nowhere, just coming up with ideas. I know our HR director does not want us to get into the business of taking temperatures at all. So I'm not sure what that looks like. Is it just signage that says, hey, if you're sick, if you've traveled, if you've X'd, don't come in? Enforcement for if someone looks sick or is coughing. I mean, at this point in the world, I think anyone who's in a group situation coughing, they're going to get the death stare from everybody else who's around them. So that may motivate them to leave. But that's kind of what we're thinking, but we just don't know.
That brings up a good point, Glenn Ann, and I wonder if anyone else has had this discussion either with HR or a solicitor. Has anyone brought up the fact of who is taking temperatures? What are they worried about when they open as far as the spread of COVID or the liability with opening back up? Has anyone talked to their solicitor? Are you using waivers? Are you adjusting your old waiver? Any information on that? Does anyone have an example waiver? Quiet group this morning.
Our director was meeting, this is Glenn Ann with Upper Marion again. Our director was meeting or having a phone conversation with our insurance carriers to see, what they will cover, what they require. One of the things that was brought up, and this may be smaller insurance carriers like for sports leagues, was the thought that they may not cover infectious diseases. I don't know if that's true or not, but it's a concern we have, and I think we've talked about it before. What kind of liability do we have? What do you do if someone does come down with it? How do you close your program? How do you mitigate your costs or your charges to your membership? It's just a lot of unknowns.
Great. Anyone else have contact with the solicitor regarding liability when reopening? Or is anyone else including COVID on their waivers? No. Okay.
Right now, our solicitor is reviewing our plans, and he feels that if we include what our protocols are and someone signs a waiver, then as long as we're following those protocols, we're covered. So he's reviewing it at this point.
Wonderful, thank you. Tyler, I think
Nikki, I just wanted to request, as people, you know, go through that waiver process, we haven't really dug too much into that as of yet, but we would love the inspiration to see what some look like. So I don't know if that's something that PRPS, as those come in, if maybe it could be shared as a group, but we would definitely, you know, appreciate seeing what some of the different waivers have looked like. We've looked at the Wise and a couple other for-profit companies as they've changed as well, but obviously we're in a little bit of a different ballgame.
absolutely. If anyone has examples, you can email them to me. I put my email in the chat box and I can make sure the group gets them.
Nikki, is there any way that we can set up a place on the PRPS website for document sharing?
Absolutely. What we can do, and we did this with one of the aquatics groups, we can set up basically, it's a hidden page where if you send me documents, I can put them all on there and send you all the link to that hidden page. So I can work on getting that set up later today. And if anyone has documents that they want to share with the group, again, just email them over. I can get them up on that page today, whether they're PDFs or links to helpful websites. I can definitely get those all linked and listed.
Thank you. That'd be very helpful.
Yep. There was a good question up here from Rachel. If you're looking to limit time or adjust your hours, are you also adjusting your membership fees? And this, I mean, this may have already occurred. Your center's been closed. If you already had membership fees and issues, have you refunded them? Have you just adjusted them? Have you extended the length of their membership? How is that being processed?
Again, this is Darlene calling, talking from North Fayette Township. We will extend their membership, but we haven't done it yet because we don't want to have to keep extending. We want to wait until we open to see what we have to extend to. But we've already sent the email out saying, you know, that if you have anything like rentals or whatever, like, we'll definitely extend the membership. And then the rentals, we have a policy that if you don't do so many weeks or whatever, you don't get refunded, but those timetables, they don't apply anymore until we're back full opening in that like blue phase.
Okay, great.
This is Crystal from Lake Naomi Club in Monroe County. We are, we're a private member club. We have said that if we have a surplus at the end of the year, we'll refund their membership for next year. And then our fitness membership packages will all be extended till once we open.
In Upper St. Clair, what we're currently doing is we are not charging members. They're on a monthly billing cycle. So we're not charging our monthly memberships until we reopen. We also owe them about half of a month in March. We will tack that on, as Darlene said with her facility. We'll be tacking that on to their membership once we reopen. The other thing is we're right now not looking at adjusting fees. We don't want to get into the game of fee adjustments because nobody really knows what our full operational capacity will return to normal. So we're not really interested in that, but we are offering a membership freeze option. So once we open, those that are still not comfortable returning, we're happy to freeze their membership until they are ready to do so. So that is something we've looked at. We are expecting quite a bit of membership bleeding, as I think every facility will. But you know, that's one thing we're looking at right now.
Yeah, hi, this is Maureen from Philadelphia. We've done the same thing for our fitness members. We put everybody on a freeze. It was about the middle of March, probably the same as everyone else. And then as of April 1st, we did a permanent open-ended suspension. We've not discussed what reopening could possibly look like. We are a smaller fitness center based out of a community center, which also has room rentals. We're a polling facility. We have an adult day program. So it's going to be a lot of planning, so to speak, for what it's going to look like once we reopen. We did full refunds for everybody as well. So we're going to have to, you know, decrease fitness class sizes for like Zumba and the boot camps and everything. So there's not really a lot of guidance out there as to what, other than like the 6 feet away. We did briefly discuss taking temperatures. So we're waiting on our corporate team to give us more feedback on that. They've been meeting almost daily to discuss all our service lines. What our membership, our platform software that we use recently launched new features for either live streaming or downloading videos for members. So that's something that we're exploring right now. So hopefully we wouldn't have to, decrease the membership fees right now.
Hey, this is Tyler. Would you mind sharing what software you currently use?
Yeah, sure, Tyler. We use it's MindBody. So it's like a third-party service, and then we have our app, our mobile app, and our website is linked through it. So it's really convenient for some people belong to more than one fitness center, so they can just use the MindBody app or website or anything to have their account there. But it is a fairly new feature, but it looks like it's going to be pretty easy. You just use any instructor can just log in with their username or password, and like I said, either just launch that live stream or pre-record their workout video and just save it in like a library. So I'm in the very, very beginning stages of exploring this option. We've been using Zoom for all of our fitness programs right now for our members. We're offering them free for everybody right now, like I said, just because we are a smaller center. So it's, almost the least that we can do to keep everybody engaged.
All right. Just checking out the chat. What other questions do you have right now while I go through the chat to see if we have questions or feedback that we need to address?
Hi, it's Cheryl again from Phoenixville Borough. We were really grateful for the PRPS document yesterday, just because I think that it gives us some kind of information or guideline interpretation to go off of. One of the things that we were curious about was when do not just indoor rec centers, but I think our parks and courts would probably be open before our indoor facilities. So what are everyone's kind of ideas about opening basketball courts, pickleball courts, tennis courts, so that people can maybe use those before we're able to get inside? Because that's kind of one of our focuses, is to plan outdoor programs, yoga in the park, outdoor programs, because we think people would be outside more than inside first.
Cheryl, I'm kind of in the same boat. I'm looking at, contact versus non-contact sports and what we can open in the yellow versus the red. I think that'd be great guidance to have from PRPS when they get a little bit more. But as I see it, we put signage out. There's no way to monitor it on our end because we're public recreation. We're not a private club or anything like that. So we can put the guidance out and people would have to self-regulate.
Yeah, I mean, we had to, in the beginning, maybe a month ago, we had to take all our basketball hoops down because people weren't kind of obeying the large groups. So we're just kind of like, without the CDC guidelines or some real guidance, trying to figure out what is everybody doing to kind of maybe start to offer those kind of outdoor programs. We're still in the red. We're not going to be in even yellow for at least a few weeks, but it's just something that we're trying to look forward to give people something to look forward to, I guess.
Yeah, we're in the red too. But I think in the yellow, that might be something, but they would have to self-regulate. And I mean, where do I stop being people? I'm not their mom. So I mean, at some point, people are going to have to be able to self-regulate. And when is that? Like, can that happen in the yellow? We give the guidance and we just have to count on people to follow it. It is a public court. So
I'm struggling with the same thing. I have to agree.
Yeah.
Monica Lauren again from Conshohocken Borough. We're actually talking about having park monitors, where we would have the community center staff, because it's not open. We would have some of them be a park monitor, hand out social distancing pamphlets and literature, and make sure that people, there's not a game, a basketball with 20 people playing, so we would monitor that. Anything beyond them saying, hey guys, we need to, keep our distance, that would be for the police.
I just don't think it's enforceable by the police, because it's not, how much can they really do? They can't ticket people. They can just guide people in the same way a monitor can, to be honest. So
I mean, I should have said any issues, I wouldn't want to put my staff at risk, because there are some people in this world that, things have happened because they don't want to put on a mask or they don't want to follow the rules. So I wouldn't want to put anyone at risk at that. And I would make sure that, they knew that.
That's the thing where I struggle, is putting my staff out there at all, because once you put the staff out there, then they run the risk of having the angry customers, and they'd be out there alone. Unless if you can afford to pay 2 people to monitor at a given time. So it's just them having that back support of a manager or someone to be there in the event of a struggle. That's where I struggle with putting someone out there.
Yeah, I know, I get it.
Just a quick note in the chat box, Jane Kunkel reported that they had to call the police on people breaking in to play pickleball. I know up here in State College, I go to the parks to walk and just to get some fresh air. And I've seen people on the courts. It's never, where I've been large groups. It mainly looks like families, but it's probably not. But from what I saw, they didn't remove their hoops, or, I know they're not doing rentals or anything like that. But as you mentioned, it's hard to close a park when it's a large open facility. It's, there's signage, people read signs and walk right through them. But I've also seen parents with kids on playgrounds. So, and the signage is right there and they walk right past it.
We actually had to call the police to break up a tailgating party with families when we were in the red. And we're fortunate that we can lock up our basketball courts because there's a fence around them. So we just locked the gate. The only thing that we kept open in the park was the tennis courts, because you can social distance there. But everything else, we have open fields, so we let them there to do that. But our playgrounds they've been pretty good with not getting on the playgrounds.
I think a lot of people are self-monitoring. It's just some people that aren't self-monitoring that make this really hard. And to me, I kind of feel like, what kind of authority do we have as park and rec officials to stop some of these things? We don't really have the backup of the state. And at the same time, it's hard to see it as a park and rec professional, because you want people to be outside and participating in a nice, good way. So I think it's a real catch-22 with whatever you do. You don't want to violate governor's orders, right? You want to follow their orders, but at the same time, people also have to follow the orders and they have to self-regulate. And where is the line in that for us as professionals? And where are we liable and not liable? And I think that's what's not really defined.
Yeah. Other thoughts and questions? We have a lot of people we haven't heard from, so please feel free to speak up. If you don't want to do it live on the call, you can use the chat box. A lot of different areas, people from different areas on the phone, we would love, not the phone, on Zoom. We would love to hear your questions. You're the ones who operate the community centers. So please let us know what your questions are. I looked to see if CBC had any additional information. I'm not seeing any. It's still the same stuff that's been up. So what questions?
So Nikki, this is Dan here. Results of the poll, size of community centers, 3 or 11% were small, under 50. 5 or 18% were medium. Large were 21% or 6. And jumbo, which was over 200, was 50%. So we're dealing with a lot of large community centers here.
So with that said, what kind of feedback are you getting from your members? Are they super disappointed? Are they being supportive of what you're trying to do? I know virtual fitness classes have been mentioned. Are you doing other virtual programs? Are they thankful? Are they engaging in those programs? What kind of engagement have you had with your members, and what is their response to that?
Most of what I'm getting are not from really members, but the people who want to rent, because we also do rentals. We have areas for rentals, and a lot of them understand, like they'll say, some of them will just flat out cancel, so then I'll go in periodically and we'll do refunds. But some are like, so I know that we're going yellow Friday. Does that mean we'll be able to, you know, like I have something July 18th. Are we going to be able to do it? And to be honest with you, I can't answer it. I don't know. We have no guidance that we know when we can open, because when are we going to go green? So, I mean, we go yellow Friday, like I said, but it's frustrating because we don't know, and that's how we have to answer them. And they understand, but everybody's chomping at the bit that they want to go back to the new normal and try to figure out what the new normal is.
Right.
I'm finding it a challenge to communicate with my township that they are not going to get back to their everybody's trying to get back to the normal. And in 2020, we are not going to get back to the way you see normal leagues or normal whatever. I think that that's one of the challenges also that we have as a group, is how do we educate our township or our residents of all the layers of parks and recreation, and can we embrace it and create good things for our township as it is, versus trying to get back to the way things were. That's where I'm trying to push right now, is the normal now. This is the normal this year. 2020 as we knew it is scrapped. Let's throw it away and regroup and offer this new thing this year. And I think that's where I'm getting the backlash.
I think a lot of us would like to scrap 2020. What about other people? All right, I see Phil shared a link. Jane, you're over this year. Phil, I don't know if you can speak up. What is that from Tennessee? I didn't click on it. I don't know if you can verbally tell us what that is, or even in the chat box, let me know. Phil Brady? No? Okay. I'm going to see if
Nikki, I can speak to what Phil just put out, because that's something we've looked at.
Thank you.
Tennessee, just like Phil is doing, Tennessee is our model. We've looked at Tennessee. We've looked at Oklahoma. A lot of those, Georgia, those places are opening. So we've looked at their guidelines. Tulsa, Oklahoma is another really good one. On those YMCA websites, because we're most comparable to a Y, even though we're not, we're obviously a public recreation facility, but a lot of our services mirror some of the services of the Y. So we've really looked in terms of amenities, what they are doing. So a lot of those websites, have had really great information that we've been pulling from to try to make really informed decisions about how we space out equipment, how are we going to be, maybe doing reservation blocks. because as many of you said, we're not really getting that from the state right now. They're not using language that, because I think realistically they don't know. So we're really trying to go what the with what the guinea pig states, for lack of a better word, that are opening already, what they are doing and how we can modify. And we've actually called a lot of these places, and I actually have a meeting tomorrow with a leadership team in Tulsa, because we're trying to hear what their memberships have experienced, because they're one step ahead of us. So I think that's probably just what Bill was referring to. I don't know if his mic was on. Didn't mean to speak for him, but we definitely have looked at those documents.
No, that's fantastic. I just put the link up there again in case someone didn't see it in the earlier part of the chat box. We will put this link up on the hidden PRPS community as well. And sorry, Phil, I did not realize you didn't have a mic. I didn't mean to call you out, but thank you for sharing that information in the chat box. It's fantastic. I just pulled it up, and it does look like a lot of great information. Tyler, if you let us know how your meeting went, that would be great too. It's this kind of information that's helpful, because clearly they're ahead of what our state government is doing, and this is the stuff that if we can kind of push forward to the state and to DOH and stuff like that, that's fantastic. So thank you. I'm going to stop looking at it now and pay attention to the roundtable, because I get sucked into reading all the information. So again, what other questions do you have, or what questions do you have for PRPS that maybe we can try to clarify? And I say try, because we are trying, like you, to figure out what we can while looking into the states, having conversations with DOH. I know many of you know we were supposed to have a DOH webinar that got canceled on Friday, but we are still in conversations with them to reschedule that. So in the meantime, when we do reschedule that, we might be able to add additional questions. So what questions do you have for each other on this call today? And what questions might you have for PRPS that we can still try to get clarified? And again, you can use the chat box if you don't want to speak up.
I think our biggest question, I'm Paul, I'm from Philadelphia, is just kind of what everyone else is saying, like waiting for the CDC guidelines, trying to figure out what the plan is. I work for a community center that's also houses a program for people with intellectual disabilities. So we've been doing a lot of education through our remote services about like importance of wearing masks, importance of washing your hands. So we're kind of trying to see like what barriers we may come in contact with, and then trying to just figure out what our next steps are going to be when, we're getting a lot of when are we reopening questions. And, it's also a community center for older adults. And, there's just a lot of people in and out throughout the day, and kind of trying to figure out what we're going to do and just what the guidelines are going to be for how we're going to operate.
Great. Thank you. There's also a question in the chat box. If a member becomes sick, does anyone have a COVID action plan?
Hi, this is Sean from North Fayette Township. I work with Darlene Hildebrand. That question actually kind of dovetails into my role and what we do at North Fayette. So I'm the building superintendent. So my question is to some of the folks out there, what are some of the things that you're doing differently as far as the cleaning and sanitation and disinfection of the buildings, what you're doing, implementing any new systems, any new cleaning systems? I know we're looking into that right now. We have a large area, a huge area that we have to now, not that we weren't cleaning it before, but obviously we're going to be under the microscope of the public a lot more. So what are some of the things that in your thoughts that you're doing differently? And I'm sorry, I had an issue with my computer. So if this question was already brought up, I apologize, because I just got in here. So
It was not, and it's a great question. The sanitation is a big one that's come up in many roundtables. One interesting thing that I'd never thought of was a UV box yesterday was brought up during our summer camp roundtable for equipment and tools, and there's benefits and issues related to it. Obviously, maybe not using it for a large center, but some of the certain parts of equipment and stuff like that I thought was interesting.
The reason why I bring it up is because, so we have several buildings in North Fayette Township, obviously, municipal building, public works, police department, community center, and various parks buildings that we're responsible for. Part of the issue is that we can't get cleaning products. We can't get, they're just not, it's not available. So my biggest concern, and Darlene, our recreation director, we have conversations daily about it. It's like, hey, I got a can of Lysol, we're excited about things like that. But when it comes to disinfecting it, a 35,000 square foot facility and doing it well, and opening the doors, you can't make a mistake. We're not at a place where we can make mistakes or we can overlook something. And so that's my major concern right now, is that we do open the doors, and we have to ensure that the public is safe once they come in.
This is Lauren again from Conshohocken Borough. Yesterday, I spoke to our borough manager, and our public works department purchased sanitizing foggers. I didn't know it was a thing. Just like yesterday, I didn't know that the UV, I didn't think of UV boxes for, sanitation. I brought that up to her, and that's when she informed me we had sanitizing foggers. So when we do open up, and like I said before, it's only going to be for summer camp. The areas that we use are going to be fogged daily.
Okay, that's great.
And that's for like bulk items. It's the room, right. Bulk items, things like that. Other small items will be sanitized by our staff. I'm going to assign one person that'll be responsible for sanitizing, the other items that aren't going to be fogged, and then bathrooms as well.
Okay, that was kind of where I was going with it. I'm glad that you brought that up, because we're looking into several different fogging systems as well. So thank you, Lauren.
You're welcome.
Hi, Chris Rain, Middle Smithfield Township in Monroe County. We also have the sanitizing foggers, which we've been using on our township office building. Our community center banquet hall area is not currently open, but once it does, we may use it at that building as well. But currently we are using it at our own offices.
Great. Okay, thank you very much.
If anyone has a link to the foggers, can you add it to the chat box?
Yeah, I apologize. I'm not involved in the purchase of the foggers. I just know that we have them, so I don't have the specific information for that product.
Okay, if anyone does, you can email them to me. I'll make sure that they're listed on that page and sent to the group. And speaking of that,
thank you.
Ask earlier, but can you put your names and email address in the chat box so we can make sure that you get the link to the page and the follow-up emails? I forgot to ask earlier. Normally I do it first thing, and I'm off my game today. So thank you so much. If you don't mind doing that, we'll make sure you get the information. Did anyone have a COVID action plan, an emergency action plan if someone gets sick? That was a question that came right about the same time as sanitation.
We do have a COVID action plan in place. We do, and we pulled that directly. We actually are using kind of a couple different sources. The CDC website, back in March when this all started, they released the list N disinfectants. So we kind of started putting a plan together. And the CDC website does have disinfection exposure guidelines as to what you should do in the case that there is an exposure at a community center or township, any public place, or even even your home. It seems to be pretty, they're all similar. But I would say that the one important thing that I would stress is to make sure that you're using something that is off of the list N of the disinfectants from the CDC. There's a bunch of different stuff out there. I mean, look, soap and water they're saying is working well too, but Lysol is one. I mean, there are so many different products out there. Unfortunately, it is tough to get them, but we do have a plan in place if there is an exposure.
Great, thank you. And I did just paste the link to that part of the CDC website for cleaning and disinfecting your building if someone is sick. That link is in the chat box. So thank you. I was able to pull that up real quick and share that. So, and if you're able to share that part of your plan with us, that would be great too, Darlene, or if you guys have that, could share it. Thank you everyone for your names and email addresses. I appreciate that. Just going back to make sure there were no other questions. All right, so we have to be off this roundtable today in by about 10 of 12 because we have a webinar to manage. So any last minute questions today for the group? Again, is there anything that PRPS can try to assist with? Would you like to do this again in about 10 days to 2 weeks? Would that be helpful? Dan Hendy, I see he just added a sprayer company link to the chat box for Vital Oxide. So that site's in there as well. So any last minute questions, comments, anything we can help with, and do you want to do this again?
I mean, I think doing this again in a few weeks, we might have some more information. People might be getting closer to opening up. I think now there's not much we can do because we can't even open, we're not even opening in the next phase. Most of us, we might, like I said, we might open up for childcare, but that's it for our camp. So I think that we're in a holding pattern, just like we were, a few weeks ago. And the closer we get, the more information we'll have, the more action plans we'll have, we'll have a better grasp on it. But
I agree. I don't know the timeline for CDC releasing information. That's a question that came in the chat box from Anthony. We've been waiting on the CDC to release quite a bit of information and we just keep checking it every day. So what I could do is over the next few days, maybe I'll wait till Monday or Tuesday to see if any new information has been released from the CDC, from state and federal governments, and then I'll look at scheduling another date. In the meantime, I'll create that web page and send everyone the link. If you have documents or links that you want to share with the group, again, send them over to me. I'll share my email address in the chat box again. You can just email them. It could just say Community Center Roundtable at the top. You don't need to do a fancy email. You can just send a link or a PDF. And we can get that site created pretty easily, and we'll share all the information we can. And thank you so much. I know you're in a holding pattern, Lauren. I agree. It's a tough spot to be in. But we thank you for everything you do. And I will leave the chat box open a few minutes. If you have any last minute questions or comments for the group, you can put them there. But if nothing else, thank you, and we'll see you in a couple weeks.